Hi, I'm Melissa Werner. I'm an MSN student in the psychiatric track. I'm going to talk to you about my presentation on pediatric suicide and the interventions to go that I've researched with it. Suicide among adolescents is a major concern, not only in the community, but to the medical professionals who treat those adolescents. The Healthy People 2020, one of their objectives is to decrease suicide attempts made by adolescents by 10% from 2009. And according to Healthy People, the suicide rate in Kentucky, where I practice, in 2009 was 3.5 per 100 population. And that was compared to the national rate at 1.9 per 100 population. So Kentucky was definitely higher in that aspect. In 2017, the suicide rate in Kentucky dropped to 2.8, but the national rate was 2.4, which increased. So pediatric suicide is a big problem in our country, and we're going to look at different interventions to combat that problem. I did 3 reviews. The first review was a level 1 systematic review. Eigner, Snowden, Azerno, Trenon, and Ogren, I hope I'm saying those right, did a systematic review focusing on therapeutic interventions to decrease suicide attempts and self-harm in adolescents. They did a review of 21 random control trials regarding different therapeutic processes. And then there was 5 studies that actually showed a significant effect on decreasing suicide attempts and self-harm versus the treatment as usual, which is just usually bringing them in for that 72 hours and kind of doing a little talk therapy and some medication management. The therapeutic interventions that they found were the most successful with decreasing suicide attempts in adolescents were the ones that were family-driven, like the cognitive behavioral therapy and dialectical behavior therapy. Those were the most successful in treating that short-term and long-term effects of decreasing suicide attempts and self-harm attempts with adolescents. And also they reported that CBT and DBT were one of the few kind of therapeutic interventions that have been successfully replicated in other random controlled trials. So that systematic review had real positive outcomes for using therapeutic intervention versus treatment as usual. And then the level 2 review was a random controlled trial. Azernal, Hughes, Babeva, and Sugar conducted a randomized control trial comparing safe alternatives for teens and youths, which is called SAFETY, and that is based on CBT, which is that cognitive behavioral therapy, and that was again compared against treatment as usual. The purpose was to evaluate whether they would have a suicide attempt after the therapy at the 3-month mark, and they said they concluded that the probability of suicide attempt was much lower with the teens that used the SAFETY intervention versus the teens that just got that treatment as usual, and that it was pretty efficient in preventing suicide attempts. Again, SAFETY is part of that cognitive behavioral therapy, and DBT is also kind of part of that group, and it's real family driven. So this is another kind of evidence that those interventions are working to decrease pediatric suicide. The qualitative study that I reviewed was from Stanley, and it was using, again, that CBT, that cognitive behavioral therapy, in reducing suicide attempts by adolescents. And it kind of did an acute treatment program, and I'll let you read that with the different stages of that, and it occurred over 3 sessions. And the conclusion was the CBT is a helpful tool in reducing suicide attempts in adolescents, and 100% of the participants reported that therapy was helpful. Again, this is another CBT type therapeutic intervention, which is family driven and is shown to decrease those suicide attempts. My PICO question, was in children aged 12 to 18 who are at high risk for suicide. how does therapeutic interventions such as CBT, DBT, and etc., compared to treatment as usual, affect attempts of self-harm within their school years? And all the bodies of literature that I have reviewed using that therapeutic intervention were consistent in finding that that is actually a helpful tool in reducing pediatric suicide. And the focus of all the focus of all the studies was age 12 to 18. And these studies that I reviewed were really essential in kind of the nursing practice. It shows that interventions that can reduce pediatric suicide, which is a big issue, and kind of that overall effect. We're not just doing medication management. We're not just holding them from 72 hours. We're actually using that CBT therapy in getting them to a place where they can use coping skills on their own to prevent further incidents. And in the advanced practice nurse has the advantage of treating the patient kind of holistically in all settings, not just managing the patient, but the nurse practitioner can integrate those therapeutic interventions and it can benefit the families and patients. Definitely using it in an outpatient setting can decrease the need for the patient have to be transferred to an acute inpatient. The outpatient setting is environment. It's conducive to building that rapport for the patient, the adolescent patient, not feeling so confined. So having that advanced nurse practitioner implementing those CBT type therapies during sessions and then possibly recommending more intensive CBT therapy with a specialized therapist is a great way to reduce pediatric suicide attempts. So pediatric suicide, again, is devastating, and we need more interventions to reduce the number of completed suicides and attempted suicides. The systematic review, the random control trial, the qualitative study shows that therapeutic interventions can decrease the number of suicide attempts made by high-risk adolescents. And again, CBT and DBT are shown the most promise based on their the family-based approaches and get really involving the family. So advanced practice nurses, and hopefully in my future practice, I will be able to implement and integrate that CBT and DBT intervention in that outpatient setting to reduce pediatric suicide and suicide attempts. So thank you for listening. I appreciate you taking your time, and thank you.